So I'm pleased to welcome Courtney Primeau, one of the winners of the Knowledge Translation Student Award. I just wanted to start by saying a big congratulations to Courtney on winning this award, and we're really excited to hear about your award-winning work. So with that, I'll pass it over to Courtney to tell us about her project.
Perfect. Thanks so much, Claire. And thank you to the NCCPH for organizing and hosting this webinar. Today I'll be talking to you about a project that formed a component of my doctoral thesis titled Engaging Medical and Veterinary Students in AMR Communications Research. So this is an overview of my presentation. So I'll talk about antimicrobial resistance, or AMR, and give some background info on that topic. I will then go over my research objectives and methods, my results and key findings, and the challenges and limitations that I encountered when conducting this research. I will then finish the presentation with some overall conclusions. So the overall area of my thesis was antimicrobial resistance, or AMR. And AMR occurs when microorganisms, such as bacteria, viruses, fungi, or parasites, survive exposure to a drug that would normally kill them or inhibit their growth. And AMR has increasingly become a growing global health concern, with resistant infections occurring in hospitals, healthcare settings, food animal populations, and the wider community, leading to increased morbidity, mortality, and an increased economic burden on healthcare systems. And AMR threatens our ability to treat and prevent illness in both human and veterinary medicine. And some projections have concluded that unless action is taken, the burden of deaths from AMR could increase to 10 million lives each year by the year 2050. AMR is a very complex issue that's driven by many biological, social, economic, environmental, and behavioral factors. And these are just a few examples of factors that have been identified in the literature as potential drivers of AMR. However, there's growing consensus that the major risk factor for development and acceleration of AMR is excessive and inappropriate antimicrobial use, both in human and veterinary medicine. But there are other factors that may play a role, including international travel, infection control in human and animal health settings, biosecurity on farms, and a lack of development of new antimicrobials. So because AMR is complex, it has drivers across various sectors, and it has the ability to impact several sectors, a One Health approach is necessary to address the issue. Because I've already mentioned that an important driver of AMR is antimicrobial use in both human and veterinary medicine, education and awareness among antimicrobial prescribers is critical. So both physicians and vets are important stakeholders to engage in dialogue about action to reduce AMR. So far, the knowledge translation and communication initiatives related to AMR have primarily focused on improving the use of antimicrobials among the general public and physicians. So research on the veterinary side of things is a large gap in the literature. So there were two overarching objectives to this research. Firstly, I wanted to explore medical and veterinary student perceptions of the issue of AMR and the drivers of AMR. And secondly, I wanted to identify the key messages, knowledge translation methods or strategies, and dissemination strategies for communication of AMR information with these groups. So this is an overview of the methods that I used for this research. The study population included students enrolled in the Doctor of Veterinary Medicine, so the DVM program, and the Doctor of Medicine's MD program in Ontario. So all Ontario medical schools were contacted regarding participation in the study, and they were asked to disseminate the recruitment email to their students. Out of the 6 Ontario medical schools, 4 medical schools agreed to disseminate the recruitment email, and the 1 veterinary school in Ontario also agreed to disseminate the email. So in the end, I ended up conducting 4 focus groups that followed a semi-structured guide. 3 of the focus groups were with veterinary students, and 1 focus group was with medical students. Written informed consent was obtained from each participant prior to the start of the discussions, and each participant was provided with a $25 gift card and pizza and refreshments at the focus groups as incentive for participating in the study. And thematic analysis was used to analyze the focus group transcripts and identify the key themes that emerged. So this study protocol was approved by the University of Guelph Research Ethics Board and the Public Health Agency of Canada Research Ethics Board for compliance with guidelines for research involving human participants. And the relevant ethics committees at each participating university also reviewed and approved the study protocol. The focus group guide focused on 4 main topic areas or themes. So the first was the perceptions of AMR and its drivers. Second was the content of communication or knowledge translation products related to AMR. The third was the format of communications or knowledge translation products related to AMR. And the fourth was focused on the transmission of communication products related to AMR. So I'll walk you through the different questions that were asked in the focus group guide relating to each topic area. So the first area was perceptions of AMR. So to explore perceptions of AMR, students were asked firstly what they know about the issue and also what they believe to be the role of a physician or a vet, depending on the group I was talking to, in the issue. The second area was the content of communication or KT materials about AMR. So to explore this area, I asked students what physicians or vets need to know about AMR outside of the clinical realm. So this included some probing questions about the One Health aspects of AMR. So the links between AMR and people, animals, and the environment to try and get away from focusing on only prescribing practices. And students were also asked what their patients or clients need to know about the issue of AMR. We also explored the preferred formats of communication materials. So for this section, participants were shown some example communication materials and asked questions about them. And they were told to focus on the format of these KT products rather than the contents of it. So these were the example infographics that the participants were shown. All of these products are publicly available online resources. So they were shown these 2 very different infographics. These were the other example materials that were shown. So from left to right, we have a version of a long report. In the middle, we have a fact sheet. And then we have a short report. And the topic of all of these was AMR. But again, I emphasized to them to focus on the format and how this type of tool could be used as opposed to the content that was found within each of these. So for each communication material that I showed them, I asked, what do you think about this type of communication material? What are the strengths of using this to communicate AMR information? What are the weaknesses of using this to communicate AMR information? And I also asked them, after being presented with the different options, what do you believe is the most effective method of communicating AMR information to you in the future as a practicing physician or vet and as someone diagnosing and prescribing antimicrobials? So that included questions such as, which format did you prefer? Which was the most useful? How could you see yourself using these different products in the future? And what would be the most effective method of communicating with your patients and clients in the future? In the area of the transmission of communication materials, students were asked about what would be the best or most preferred way to receive information about AMR once they're in the field as a practicing physician or vet. So I've introduced the 4 topic areas of the focus group guide. And so now I'll walk through the major themes that emerged under each of these topics. So for knowledge, these are the themes that emerged under the topic area of knowledge and perceptions of AMR. I won't spend a ton of time talking about this theme, as I want to spend more time on the KT and communication themes. So firstly, reliance on antimicrobials in human and veterinary medicine was discussed. So both groups recognized that antimicrobials were critical to the functioning of human and veterinary medicine. And they also talked about how losing the effectiveness of these drugs creates major impacts when treating their patients and clients. They also discussed the drivers of AMR across both human and veterinary medicine. So both groups recognized that antimicrobial use has a major impact. An interesting focus in both the human and veterinary groups was the focus on antimicrobial use in food-producing animals, as well as a lack of awareness or education amongst patients and clients. The importance of collaboration between human and veterinary health professionals was also discussed as an important thing to acknowledge, and that just speaks to the One Health nature of the issue. And external influences on the perceptions of AMR were also discussed, particularly with regards to the general public. So this discussion focused mainly on the role of the media in shaping public perceptions. When asked what they think future communication products should communicate or focus on, they identified three major themes. So the first was content to address pressure to prescribe antimicrobials. So both medical and veterinary students highlighted the impact of patient or client pressure to prescribe on the use of antimicrobials. And both groups had highlighted their own experiences, even just despite being students in their clinical rotations, seeing this in person. They also emphasized the importance of developing content and KT products that were targeted for different audiences. And they also focus on content to improve understanding of the issue amongst doctors and vets. So patient pressure to prescribe was described in depth during the focus group with both medical and veterinary students. With medical students, they discussed the challenges of balancing patient needs and desires with prudent use of antimicrobials. Patient pressure emerged as both a perceived driver of the issue as well as a key area to focus on when determining content for future communication materials for patients and clients. And both medical and veterinary students felt that their patients and clients needed to know about the issue of AMR, what it is, and how it could impact them, as well as the distinction between viral and bacterial infections. The participants felt that if these aspects were communicated effectively to patients and clients, it could decrease the pressure to prescribe and potentially have an impact on AMR. So this is what one student said. They said, sometimes it is confusing for patients. Sometimes your infection is caused by bacteria. Sometimes it's caused by a virus. It can send confusing messaging. And they need a basic understanding of viruses and bacteria and how we would go about treating each. Another participant highlighted that when patients have an improved understanding of the issue, they may be less likely to ask for an antimicrobial and the interaction may be less confrontational, explaining that they need to have a general understanding of AMR, what causes it, why it's so important, so that they don't pressure the physician and they do understand the issue. So across all focus groups, students indicated that the need to consider different target audiences when developing communication products to enhance knowledge and understanding of AMR. So students described the need to consider different levels of knowledge of AMR and the importance of tailoring products to the target audience in order to enhance awareness and information uptake. And furthermore, several participants recognized that one communication product would not be suitable for all target audiences, and a more widespread, comprehensive knowledge translation strategy encompassing many communication products is needed. As one student indicated, you need to be aware of differences in knowledge and what the average person in society is aware of. You need a general, widespread approach to educate, and you can't just use one tool to reach everyone. Another participant highlighted that when patients have an improved understanding of the issue, they may be less likely to ask for an antimicrobial. Oh, sorry, I think I disconnected there for a minute. So another student noted that there's no one-size-fits-all approach when it comes to communicating this type of information, especially because it is so complex. The major theme that emerged during the discussions of the example communication products was the need to balance the quantity of information with visual appeal of the communication product. So when presented with 4 different communication products, the preferences varied both between the medical and veterinary focus groups and within each of the respected groups. So overall, students felt that the most useful communication product for practicing physicians or vets was the fact sheet. An interesting finding was that both veterinary and medical students found that the example infographics were the least useful communication product. Although they did acknowledge that this format presented information in a digestible way for certain target audiences, such as the general public, they felt that it didn't provide enough information to explain why AMR is important, why we should care, and what we should do about it. And it was therefore challenging to make this type of communication product impactful for this purpose. However, the utility of this type of product for some audiences was discussed. In terms of communication products for patients or clients, both veterinary and medical student participants felt that graphics are important. So veterinary student participants felt that if a communication product was not visually appealing, it would not attract the target audience and it would reduce the uptake of information. Medical student participants echoed those sentiments, indicating that the other communication products may not be as easily embraced as infographics because there may be too much information that they're not willing to read. So overall, all medical and veterinary students agreed that a comprehensive approach would be needed and that no single communication product could be used for all target audiences. This is a remark that one participant made about the fact sheet. So they said that it contains a good amount of information so that you're actually learning something, but not too much to overload you to the point where you can't even determine what the key messages are. So the major theme that emerged under the dissemination of KT and communication materials about AMR was accessibility and reach of communication materials. So the importance of making communication products accessible to the target audiences was discussed in the medical and veterinary student focus groups. Veterinary students felt that distributing communication products to clinics on a regular basis would be effective, particularly for those in small animal practice, rendering products accessible for veterinarians and in a way that they can be easily distributed to their clients. The students felt that distributing hard copies of the communication products would be beneficial, as clinics could then post or distribute these as they see fit. And the veterinary students also acknowledged that some vets outside of small animal practice may not be routinely working in a clinic setting. So they also suggested that products be distributed at things like industry meetings, conferences, or other events to reach veterinary professionals that are working across different settings. Medical students raised similar comments and felt that distributing KT products to clinics would be an effective way of reaching both physicians and patients. And the importance of social media in disseminating AMR information was also discussed, with one participant stating that social media is a really good way to reach the general public. So many people use social media, and this could be a good way to raise more attention and awareness of the issue. So overall, the key findings from this research show that veterinary and medical students believe that AMR is an important global issue, and they highlighted antimicrobial use in food-producing animals and human medicine as the key drivers of the issue. Both veterinary and medical student discussions highlighted the importance of addressing patient and client pressure to prescribe antimicrobials. Both veterinary and medical students indicated that a short 2-page fact sheet was their preferred communication product, although they did acknowledge that a full suite of KT products would be necessary in order to meet the needs of the different target audiences, so both antimicrobial prescribers and users. So hopefully this research will help inform the development of future communication materials and support the development of AMR knowledge translation tools that are tailored to the needs of different professional groups. So this was a really rewarding research experience, and I learned a lot, especially from the various challenges that I faced conducting this research. Participant recruitment for the focus group was challenging, and it resulted in fewer focus groups being conducted than originally planned. Several institutions had their own ethics processes in place for conducting research with medical students specifically, and these processes often required a local investigator to oversee the study. So because our research team was largely based at a single institution, it was difficult to access the student populations at other institutions. Additionally, there were few responses to the recruitment email, and scheduling issues with interested students were also challenges when recruiting medical students specifically at several universities. We had also planned on including pharmacy students in this research, as pharmacists play an important role in communicating with patients about their prescriptions, but we faced similar challenges with recruitment at the 2 Ontario pharmacy schools. So overall, although this study provided an in-depth exploration of medical and veterinary student perceptions of AMR and preferences for knowledge translation and communication strategies, there are several limitations to this research. There's likely to be some bias arising from the focus group discussions, particularly with the medical student focus group, as there was only one medical student focus group conducted in comparison to the 3 veterinary student focus groups. Overall, across all focus groups, there was a lack of diversity in the sample of medical and veterinary students in terms of year of study. So most study participants were first-year students. In the veterinary groups, I did manage to get at least one participant from each year of study. So that was good, but a more equal distribution across the 4 years may have provided additional perspectives on the issue of AMR, and future studies could target students that are farther along in their education, as they may have different perspectives as a result of completing more coursework and clinical experience. And it's also important to acknowledge that the participants in the focus group were students and not healthcare professionals that are currently working in the field. Healthcare professionals may have different views on AMR and different communication preferences compared to students who are training to be professionals based on their experience with different cases, patients, or clients. So in conclusion, this research demonstrated that Ontario medical and veterinary students recognize the importance of AMR and our reliance in human and veterinary medicine on having effective antimicrobials. So by investigating these student perspectives, public health agencies and researchers will be in a better position to develop effective targeted communication tools in order to address AMR in each of these groups of health professionals. And future research should attempt to incorporate other health professionals such as pharmacists, nurse practitioners, and dentists, as these groups can dispense and/or prescribe antimicrobials, and they also play important roles in primary health care in many communities. So continuing this research and incorporating multiple diverse viewpoints will help further determine the key messages, format, and method of delivery for KT tools that are aiming to address this significant public health issue. So with that, I would like to acknowledge my wonderful PhD advisory committee, my funding sources, the NCCPH, for recognizing this research project and awarding me and allowing me to deliver this webinar, and of course my focus group participants. And I would like to direct any questions about this to the email on the slide. And thank you for listening.
Wonderful. Thank you, Courtney, for sharing that work with us. It sounds like really important and timely work. I just have a few questions. So I'd like to know, what are you doing now and where did your graduate studies lead you?
Yeah, so I'm currently working as an epidemiologist with the Public Health Agency of Canada, and I'm in the area of AMR surveillance, looking at surveillance in both food animals and in humans, so still working in the same area. And I'm very lucky in this role to still be able to continue doing knowledge translation and communication work by developing different products for different target audiences and stakeholders in our program.
That sounds really great. My second question is, what inspired you to learn about knowledge translation and why did you want to incorporate it into your project?
Well, I first learned about knowledge translation in my public health communication course as part of my Master of Public Health degree. I wanted to incorporate it in my project because AMR is such a complex issue with so many facets, and previous research has showed that there's so many misunderstandings and misconceptions about the issue, especially among the general public. But there are many different AMR KT products that are out there that have been developed by various different agencies. So I thought it would be beneficial to go directly to our stakeholders, or our future stakeholders, I should say, as their students. So people that will play an important role in the issue, and ask them what they would like to see, what resonates with them the most, what they think is most effective in terms of KT and communication, because I think that could have a really significant impact.
That's great. One of the findings that I found it really interesting in your work was about the preference for fact sheets over infographics. And just thinking about how infographics are often used in public health, I was wondering if the students had any kind of tips or tricks or things that they particularly liked or didn't like about the infographics that could help with designing better.
Yeah, so they didn't really
have,
so they didn't really have any tips necessarily. And I think a lot of that came from me telling them to focus mainly on the format as opposed to the content. So it wasn't even that the content wasn't good. It was just that they really didn't like the format. And I think it came down to them thinking that there's just not enough space for it to be visually pleasing and also have actionable messages for people to know, like, why is the issue important? What should I do about it? And so I think that's why they preferred the fact sheet. However, they did recognize that the infographics were beneficial for certain target groups. And so I guess what I would take from that is professional groups may not want to see the infographics, but we should definitely still be developing them for different audiences, especially audiences who are not likely to read a long report or even a fact sheet. So I would make sure that there's actionable messages on there, but why it's important and what they need to do about it, because those are kind of the key aspects that the students felt couldn't be explained thoroughly on an infographic.
Perfect. Thank you for sharing those insights. And I just had one more question. So the students had noted that these fact sheets and products should be delivered to clinics. And they had also talked a bit about social media, but just recognizing now that a lot of things are online, are there any ways that you think could be good to disseminate those products online?
Yeah, so another area that did come up that I just didn't have time to talk about was via email and kind of a newsletter type thing. So that discussion point did come up as well, where some students suggested that that might be a beneficial way of accessing physicians or vets in practice, whether that be through, their professional associations, whether it's a monthly newsletter, that type of thing. So I think especially now that a lot of doctors aren't even doing in-person visits, and same with vets, vets aren't meeting necessarily with clients. I think that aspect will become a lot more important, as well as the social media point of view as well. If reputable agencies can be sharing these types of materials online, as more and more people move online for work or school or whatever, I think that that could have a really positive impact.
Great, thank you. And I just wanted to ask if there's anything else you'd like to share about your work, or if you have any last words.
I would just like to thank you guys for allowing me to share the results of my research through this forum. And I would also like to thank my focus group participants once again, because without them, this wouldn't have been possible. And I really appreciate them, especially after all of the recruitment challenges that were part of this research.
Great, and thank you, Courtney, for sharing this really important work with us. And once again, big congratulations on winning the award. And I look forward to all the work you're going to do in the future too.
Perfect. Thank you so much.